What's up, guys? Happy Hump Day, February 7th, 2024. And this thing all fired up. Hope everybody's having a good week so far. Feeling good. All right. Good evening, esteemed viewers, and welcome to another transformative episode of Know Your Pharmacist. I'm your host, Dr. Joaquin Acosta, CEO of PharmTrue, and tonight we embark on a journey that transcends the conventional, where health meets innovation at the crossroads of human understanding. In tonight's episode, we delve into the heart of healthcare evolution. Our Pharmacist Frontline segment will unravel the collaborative dynamics between pharmacy leaders and the HHS. Imagine a synergy that's reshaping our healthcare landscape for better or for worse, where unity and perhaps knowledge foster advancements in public health. Next in Tech Talk, we'll uncover a groundbreaking leap in medical diagnostics. The Genius digital diagnostic system is not just technology, it's a beacon of hope, illuminating the path to early cervical cancer detection, where cutting-edge AI meets compassionate care, revolutionizing how we approach one of the most pivotal aspects of women's health. During our Enlightenment Hour, prepare to be captivated as we explore the mysterious ways in which odor influences our brain's decision-making processes. It's a fascinating dive into the neurological wonders that shape our choices, underscoring the profound connection between our senses and cognitive functions. Our Herbal Wellness Corner tonight is a vivid exploration of the diverse consistencies in dabbing, each texture a different chapter in the cannabis narrative, offering unique experiences that are both enlightening and therapeutic. In our community spotlight, we celebrate the strides made by Albuquerque and Las Cruces, cities that are surging forward in national rankings. It's a testament to the resilience and determination of communities that inspire greatness. Finally, our Men's Health Minute sheds light on the health disparities faced by men. Here we empathize the importance of preventative care and healthy lifestyle choices, underlining the power of awareness in bridging the gap to a healthier future for them. Tonight, as we weave through these diverse yet interconnected realms, our mission remains steadfast, to enlighten, empower, and inspire. Join us in the educational odyssey in this, for together, we are not just viewers and hosts, we are collaborators in the grand narrative of health and well-being. Let's shape a more informed, healthier world. Together, we are unstoppable. Welcome to Know Your Pharmacist. Let's embark on this journey of discovery, growth, and transformation. So jumping right on in, guys, in our Pharmacist Frontline segment brought to you by PharmTrue, just unpacking some of the headlines between the collaborations of the Human Health and Services, Secretary with the big pharmacy CEOs. Why are we looking at this? Because it's interesting. What are they talking about? They're talking about COVID. They're talking about Paxlovid, specifically in this case. What happened is, somehow, some way, with COVID-19 therapeutic commercialization coming out, Paxlovid came out within different state programs and widely distributed very fast, in response, obviously, to COVID, right? There was molnupiravir and that as well. However, where you're looking at everybody coming together to, dispense out a quick, right, oral solution for COVID-19. That's where Paxlovid, entered the scene, and it was supposed to be free, right, for basically everybody, or if not, maybe like a penny on the dollar, right? Like you're not paying for it, right? And neither were you supposed to ever pay for COVID shots. And somehow, some way, pharmacies in places ended up charging people, outright for these shots for whatever reason. They couldn't understand the billing. And so when, the codes had been given out multiple different times about how to bill for Paxlovid, how to bill for molnupiravir, what different, billing codes you had to put in there, people ended up having to pay hundreds of dollars in some cases for their dose of Paxlovid. And this is Paxlovid, guys. Something that was expensive, right? Ivermectin was expensive during that time. It still probably is. But if you're going to get ivermectin from a pharmacy, commercially, you were going to be paying anywhere from $7 a pill up. If you were going to be that person that went to, right, the food store and bought somehow ivermectin powder for horses and did that whole thing, that was a different, unregulated, complete deal. But again, there were providers that were doing, ivermectin protocols, whether or not some people agreed with it or not, we saw it all, right, from the pharmacy. So again, I'm looking at this here because we're looking at this being a huge problem with the U.S. Department of Health and Human Services. All of a sudden, you have to get all the CEOs from Walgreens, CVS, Walmart, all together to come talk about, how this happened. Guys, we have so many different other problems in healthcare going on right now, right? Like, the burden of type 2 diabetes on our country. February is cardiovascular, health month. We have medication adherence being one of the biggest reasons for cardiovascular events, right? Things that pharmacists could really help with that people aren't really doing, and the systems that those big companies are setting are not doing a very good job at supporting, leading to thus decreased outcomes on the backside and increased cost on the backside, right? Where we're looking at, hospitalizations, rehospitalizations for ketoacidosis, for poorly managed type 2 diabetes, or whatever these things may be, stroke, heart attack, right? Cardiovascular events, going and having those events that are completely preventable, with better healthcare systems in place, right? Versus not. These are not the things that they're talking about. So, historically, I was trying to look at the other times, in the last 10 years, even Health and Human Services and pharmacy have intervened or intertwined and met. So I guess Donald Trump selected Alexander Azar, and he came from Eli Lilly to come be, I believe, like our, Health and Human Services administrator or whatever. So that was pretty interesting. But the work that has been done collaboratively between pharmacy, right, and that you're looking at not much. They did push for progressiveness in terms of pharmacists prescribing birth control. That was one of the things. But, in terms of what are we doing to help our country and our healthcare, that's not very much action happening over the last 10 years, between our Health and Human Services Department and pharmacies, right? And the big pharmacy companies that are controlling, a ridiculous amount of money in our society, right? And, this is not where we're looking at, for instance, I guess, me personally, I'm not looking at demonizing anything here by any means, but I think this is an important thing to say. Like, again, this is the Bernie Sanders literature right here that I'm going to show you. And so, this is not my political affiliation, but some of the problems here that he's dissecting actually are interesting, because if you think of if the costs were actually appropriated more properly, would we actually even be having these problems in the first place? Right? So the pharma pandemic profiteers, 50 pharmaceutical executives and 10 companies made $1.9 billion in 2021 and could receive $2.8 billion in golden parachutes. 10 pharmaceutical CEOs could receive $1.6 billion in golden parachutes while Americans struggle to afford life-saving drugs. 10 pharmaceutical companies made $102 billion in profits in 2021, 137% increase from 2020. Right? All over the country, American people want to know, why is it that the United States pays by far the highest prices in the world for prescription drugs? Why is it that nearly 1 out of every 4 adults cannot afford the medicine prescribed by their doctor? Why do nearly half of all the new prescription drugs in the United States cost more than $150,000 a year? How is it that in Canada and other major countries, the same medications manufactured by the same companies sold in the same bottles are available for a fraction of the price that we pay in the United States? All true, Answers to the questions are not complicated. In fact, they can be summed up in 3 words. Unprecedented corporate greed, right? Hence capitalism. Not a bad thing. We live here, America, greatest country in the world, right? Over the past 25 years, the pharmaceutical industry has spent $8.5 billion on lobbying and over $745 million on campaign contributions to get Congress and the government to do its bidding. Incredibly, in the last year, the drug companies hired over 1,700 lobbyists, including the former congressional leaders of both major political parties. Over 3 big pharma industry lobbyists for every member of Congress, and it has paid off big time. looking at all of that, right, is just a very, 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 crooked situation. And we can sit there and unpack the whole argument, but really, like, the heart of it is somehow there's an insane amount of price spread here in the United States. We have balloon pricing for any other drug ever. Whatever back end deals that a lot of the pharma execs, set up in global situations, right? This is, an interesting parallel to some of the things where you see just money being put in bad places, when it's coming from government spend into other places. So, you look at the profits there and all that, sure, you're entitled to all your profits. But again, where Americans were basically, conned into becoming 80% consumers of the world's opioids at 5% of the world's population, it's a damn shame to think that, yeah, pharma did one hell of a job, right? They, brainwashed and hurt our country in a lot of different ways, even just right, yeah, for corporate greed. And there's, of course, that happens everywhere in every regard, but this one's out there, this one's exposed, right, and it's ugly. And so, where does that get read out? Because when we look at the big powers that are there, right, where you can pay for 1,700 lobbyists, we should be having better conversations for how to fix things like medication adherence or hospitalizations and rural healthcare, a lot of different things that are being obviously kind of just neglected for quick profits or whatever it might be, weight loss or something like that. So it's just very interesting. So got a point here from Nicholas talking about, I'd like to see more emphasis on pharmacies offering verbal counseling instead of getting rid of the electronic offers to counsel. That would require more companies to have appropriate staffing to offer more. For sure. Yeah, I don't know if you saw, the state of Ohio just, Board of Pharmacy just recently fined $250,000 to CVS, and they're asking for different things like this. So, they're making sure that, or they're trying to, take a stance in terms of ensuring adequate staffing and things like that, and even systems in place for pharmacists and technicians to anonymously be able to report, fucked up working conditions. Anyways, I'll stop kind of ranting on that. I'm just saying, look at the energy and the media and the time being spent on this from the Health and Human Services Department. You have the DEA shutting down pharmacies from introducing cannabis in the state of Georgia because they can't agree with the Health and Human Services Department on a recommendation for rescheduling cannabis because it's fighting lobbying, right? And this is what we're talking about right now. It's a damn shame. Not that it shouldn't be addressed, but just another interesting point. Guys, let's talk about let's talk tech talk. So here I've got Hologic announcing first and only FDA-cleared digital cytology system. I'm going to show you guys about this, but guys, we're talking about cervical cancer. Very interesting stuff going on here. That's coming out for, detecting cervical cancer. And so let's take a look here. Now, these guys just got FDA approval.
I'm Dr. Mimi Secor, nurse practitioner. I work at the Newton Wellesley OBGYN practice in Newton, Massachusetts. I've been a nurse practitioner for 38 years, specializing in women's health. I'm also an educator, a national speaker and consultant, and an award-winning author, and I just love what I do as a nurse practitioner. I think what's really impacted me as a nurse practitioner is working with underserved high-risk populations. Women that I've worked with over the years that maybe are newly out of prison, that are homeless, that have no health insurance, maybe they're undocumented citizens, and providing them with cervical cancer screening, detecting problems before they become a statistic. That's highly emotional for me, very impactful, and one of the many reasons why I love being a nurse practitioner. I think what's so important for patients is to create a comfortable environment for themselves. And they can do that by, number one, finding a great clinician that they feel like brings out the best in them, that really they feel connected to, and then being an active member of that relationship, bringing a few questions, bringing a curiosity, and that willingness to really work in partnership. I see it so often with women that they don't really get the impact of how important it is to get cervical cancer screening. They don't know much about cervical cancer. They don't know much about HPV. They just, regardless of their educational level, regardless of their socioeconomic level, the research really bears this out that women need information. They don't have as much as maybe they think they have. We know that when we add HPV to the PAP test, PAP plus HPV, increases the chances of detecting a problem. So it increases survival potentially. It's a life-saving combination for women 30 and older. It's essential that women learn more about PAP and HPV. Well, the PAP test I've been using a long time, 38 years, so I remember the glass slide PAP, and then I also remember the exciting innovation of the liquid-based PAP and how much more accurate that test is. So we've gone from a good test to a great test, and I've been able to experience that with my patients. I think the one piece of advice I'd like to give women is to understand the importance of getting their screening tests, their PAP, with HPV testing. I have a sense from a lot of women that they're really not too concerned about cervical cancer. They don't realize 4,000 women die each year. They don't realize 10,000 women are diagnosed with cervical cancer. They don't understand that they may also be at risk. And so I just want women to know that they need knowledge, but they also need to be responsible in their healthcare.
So basically, looking at the mission of the company in there and everything with Hologic, I think it's a lot of cool stuff there. But in terms of the cervical cancer screening, basically, literally just got right their FDA approval, and it's cool. So that's what we're talking about in our tech talk today, and this is what it looks like. Basically, they use as all new technology is going now, basically AI to help to look at cells and analyze cells and screen cells. So, as they say, screenings for cervical cancer include a PAP test, where a sample is generally collected in an OB/GYN office and the cervical cells are sent to a lab, where they're transferred to a glass slide. To this date, this glass slide has been reviewed under a microscope with Genius digital diagnostic system, and the glass slides are digitally imaged, and an AI algorithm is applied to pinpoint the cells that cytologists and pathologists should review. Right? So radiology and all that, pretty cool. The new process and technology demonstrated an overall improvement in sensitivity without a corresponding decrease in specificity. Notably, there was 28% reduction in false negatives of high-grade squamous cells, intraepithelial, and more severe lesions compared to microscopic review. The Genius digital diagnostic system will help laboratories arm healthcare professionals with information they need to guide more timely and effective treatment decisions for patients. So, I'm excited to see exactly how that gets implemented in healthcare systems. Obviously, it was really cool to see that doctor there talking about where she was able to use it in underserved communities and be able to really, help prevent versus, as she said, become just another statistic. So this is, a very cool technology in terms of all the different types of, cancer screening detection that are coming out. But cervical cancer, one of the big ones, HPV vaccines, women basically under the age of 40, you guys are for sure eligible if you haven't had one, right? And talk to your doctor and pharmacist about those vaccines as well. But, cervical cancer screenings and the whole thing, making sure we get the routine checks. All right, let's jump on to our Enlightenment Hour. Let's go from the cervix to the nose or the brain, right? Interesting stuff, how odors influence the brain's decision-making mechanism. And right, so I think, kind of can visualize how our senses react when we smell Taco Bell, for instance. Right. Anyways, summary: researchers have uncovered a novel function of the hippocampus in decision making, showing that specific brain cells known as time cells are stimulated by odors to facilitate rapid go, no go decisions. This study demonstrates how mice learned to associate fruity odors with a reward, leading to quicker and more efficient decision making. By tracking the activation of these cells in response to sense, the team has revealed the direct link between odor, hippocampal function, and associative learning, suggesting that these cells play a crucial role beyond memory recall, directly influencing the brain's decision-making process. Key facts: the study identifies time cells in hippocampus as key players in the brain's decision-making process, stimulated by specific odors to trigger rapid decisions. Mice were able to associate fruity smells with positive outcomes, showing how odor cues can enhance the learning of decision-making behaviors. This research sheds light on intricate relationship between sensory perception and cognitive processes, revealing new insights into the hippocampus's role in associated learning and decision-making. So, looking at it, right, the scientists focus on the hippocampus area in the brain, crucial to memory and learning. They knew that so-called time cells played a major role in hippocampal function, but didn't know their associative learning. These are cells that would remind you to make a decision to do this or do that. Study's senior author, Diego Restrepo, doctor, PhD, a neuroscientist and professor of cell and developmental biology at the University of Colorado School of Medicine. The researchers observed that when mice were given the choice of responding to a fruity smell by licking on a spout that delivered sweet water, they quickly learned to lick the fruity smell as opposed to the smell of the mineral oil. They have to associate the odor with the outcome of what they are doing, so that's why they learn the decision making. Right? When it's a fruit odor, they lick and get a reward. When it's mineral odor, they stop licking. And the more they learned, the more their cells were stimulated, leading to more rapid decoding of odors and allowing mice to quickly become proficient using the fruity smell. So, looking at that, right, we didn't know if there was decision-making cells in the hippocampus before. Hippocampus, multitasking, little organ in there. Cells are not always turned on, right? Because otherwise it could become overwhelming. So, looking at this and what it could even kind of boost us at, guys, this takes you all the way down to maybe even the therapeutic, potential when it comes down to things like cannabis terpenes, for sure. Obviously, right now in Valentine's season, things like that, perfume, why does that perhaps, have we trained ourselves at this point, right, to associate those things? So what came first, the chicken or the egg, right? Some of those things. And another things we're not even unpacked there too is hormones, right? People say, whether or not you can necessarily smell the hormones and particularly, sense the smell of them. Sometimes I've heard, and I'm not going to jump into studies about that today, but about the passage of that through that mechanism. Anyways, let's talk real quick in our Herbal Wellness Corner, brought to you by High Horse Cannabis Company, guys. I hope everybody's shopping High Horse for all those super insanely great deals on some high quality cannabis extracts, edibles, and all of that over at High Horse, guys. But what we're talking about today, as you see their diverse menu on the website, a lot of different extracts, guys. And talking about extracts, cannabis consistencies, and how the whole thing works, guys, I just kind of wanted to give a quick little, run through of some of the differences between dab consistencies. So, the most common old school dab consistency is shatter, right? Where you think of literally like a glass-like brittle texture. What happens when you get shattered? You either have your hydrocarbon extract, right, which gets purged and turned into very vacuumed out process where it quickly becomes shattered. You remove the air, you remove everything else minus just that THC oil, where it hardens up and has perhaps some other phytocannabinoids and terpenes and flavonoids. You know, crumble, right? Dry and crumbly. Crumble can be made, right, using either ethanol or hydrocarbon. Same thing as shatter, right? And you have to actually purge and then dry it a little differently, to get that texture. So when we're talking about the textures between the different dab consistencies, some people like them for one reason or another. Mainly comes down to personal preference rather than a therapeutic benefit. Therapeutic benefit, the only way you could really argue it would be, you know, I'll get there. So butter and wax, right? Butter or wax, straight up creamy, buttery consistency is when you agitate the concentrate while you're actually purging and vacuuming out, causing everything to separate and form that texture. But looking at everything else from here, terp sauce and diamonds, these different dab consistencies have higher terpene profiles. So, the extraction processes actually do take into account, how to preserve the terpenes inside of the extracts. And, terpenes in and of themselves have different therapeutic benefits. Terpenes are probably more so what people get confused with things like indica and sativa, because indica and sativa are a big myth, right? They don't make you do the things that they say, right? Sativa saying it's going to wake you up, and indica saying, right, you're in the couch. Those don't exist. You're looking at terpenes. Talked about terpenes a little bit earlier this week. I believe maybe on Monday, looking at entirely how things like linalool with lavender scent makes you go to sleep. Pinene causes alertness, right? Coming from pine trees, smells like pine sol. Limonene, right? Some nice anti-anxiety, relaxing effects, citrusy, right? And these are things that are in addition to um, the actual THC percent in that oil. So, if you want to get the max terp effect and you actually knew the terp profiles in there and you knew what you wanted to get out of them, you could shop, live diamonds or sauce. You're just going to have the max amount in it. But, industry testing doesn't even make that a necessity right now. So it is what it is. Last one, other than that, is basically your live resin, live rosin, right? And those come from fresh frozen flower that's basically just pulled right out of the greenhouse, the field, whatever it may be, the pot. And by pot, I mean, soil pot. Anyways, a lot of different consistencies there. The means to an end really come down to personal preference right now, for sure. If you could absolutely geek out, you could geek out into the terps. But again, you'd be betting against the data because you don't have a lot of data to work with. Unless you just truly knew how to connect the senses to the terps. All right, guys, let's move on to the community spotlight brought to you by the Big Chicken Farm. Shouting out Las Cruces and Albuquerque, but we're shouting out, of course, Las Cruces. Sorry about that.
7th best performing large city in the last report to the 100th best here in 2024. Las Cruces rising from the 121st best performing small city in 2023 to 79th overall in 2024. Both Albuquerque and Las Cruces, though, do remain ranked lower than they were pre-pandemic, but the improvements from the 2021 data that was included in the 2023 report are very significant. And after spending 3 years at the bottom of the list, Farmington rose from dead last to 189th best performing small city. Santa Fe, though, was the only New Mexico city on the list to see a drop. It fell from 124th best in 2023 to 145th. It's worth noting, though, that this report is based off data from 2022. Rankings are based on 13 factors, which fall into 3 general categories: labor market performance, which reflects trends and employment and wages; also high-tech impact, which reflects the growth of high-tech industries; and finally, access to economic opportunities, which looks at housing and digital services such as broadband internet. And of course, we know this is a whole lot of information, so you can read the entire.
Anyways, pat yourself on the back. Las Cruces on the come up there. Good job, everybody. Working hard. Last thing, guys, in our Men's Health Minute, just sharing briefly the Healthy People 2030 goal of improve health and well-being for men. Preaching about it every day. Men die an average of 5 years earlier than women. Healthy People 2030 focuses on improving men's health. Men are at higher risk for many serious diseases, including heart disease, lung cancer, and HIV. Men also face unique health problems that don't affect women, like prostate cancer. To improve men's health, it's important to raise awareness about preventative screenings and regular health care for men of all ages. Interventions to reduce smoking and drinking and promote healthy behaviors can also prevent diseases and improve men's health. So, in our one little quick minute of that today, happy birthday to my pops. In our Men's Health Minute, guys, always make sure that you enjoy those moments for show. And, in terms of a big, hairy, audacious goal, Healthy People 2030, improve health and well-being for men, that encompasses a lot of things. And, truly that preventative awareness is what it's going to take. It's going to take a long time to get to that point, to create some perhaps habit changes and create some, positive outcomes there. But we get a little better each and every single